Good morning. My name is Dr. Dustin Sulak. I'm an osteopathic physician with a general practice in Maine. And over the last 6 years, my practice has focused on cannabinoid medicine. It's grown from a small private practice to 3 locations in New England. And together with my colleagues, we take care of 18,000 patients who use medical cannabis to treat real health conditions. Today, it's my pleasure to share with you what I've learned about how to dose cannabis to find the optimal therapeutic effects. But before I do that, I'd like to share with you the story of one of my patients named Bryce. Bryce first came to me, a 12-year-old wonderful boy who had autism, and at the time, he was experiencing severe self-injurious behaviors. Bryce would hit his head with blunt objects or literally try to put his head through the wall. And by the time he made it to my practice, he had tried every class of drugs that could potentially help him and had failed them all. He got started on cannabis brownies that his mom made him, and he was doing well for a few months before something happened with one of the batches of brownies and he decompensated. The behaviors returned. He ended up in the emergency department. He spent a full week in the emergency department without any cannabis, getting worse and worse over time as the cannabis was leaving his system. Over that week, I had suggested that we try some synthetic THC, which is available in every pharmacy, including hospital pharmacies. And finally, a week later, after Bryce had to be restrained for much of that time, there was no facility in New England that could take him that had the type of care he needed. The emergency room doctor called me and asked that crucial question: how do I dose THC? Thankfully, I was able to calculate about how much THC he had been getting when he was doing so well, and I told the emergency room doctor to give him 10 milligrams of dronabinol, which is a synthetic THC. Over the next 3 hours, his symptoms totally resolved. He became calm, happy, actually started giggling, and he left the hospital. He hasn't been back to the hospital since. 3 years later, he's a productive member of society, now 15 years old, grilling vegetables for his mom's salsa company. The key to Bryce, to keeping him out of the hospital, is knowing his optimal dose, which actually hasn't changed over time. Bryce is stable and healthy. He's doing great. My practice is called Integrate Health, and for my career, my training, and even my early life, I've been interested in healing. What is healing? How does it work? How can we stimulate healing? How do we remove the obstacles to the healing system so that it can function fully? And in my training, like Dr. Agarwal, I became aware of these terms cannabinoid and endocannabinoid system. It turns out that as researchers looked for how does THC work, they discovered a whole system of physiology that's integral to our capacity to respond to illness and injury, to maintain balance at a cellular level, and actually to stay healthy, to promote that balance over time. I realized very quickly, working with patients, that there's no simple answer. Cannabis can't be dosed like a pharmaceutical. Take 10 milligrams or take 5 milligrams 3 times a day. It doesn't work for everyone. This is a very unique medicine that treats each individual as a unique person. And to find our optimal dose, we have to go through a method of experience working with the plant. So while I can't tell you your perfect dose, and while I believe no physician could, I can teach you how to find it for yourself. To help with that, I've created healer.com, which is an educational website that leads people through step-by-step how to find your optimal cannabis dose. That means how to get the best results with the least side effects or without any side effects. And to figure out what was working and what's not working, and to help some of my most delicate patients get accurate, consistent dosing, I opened up a cannabis analytic lab in my medical practice. I believe we're the only ones in the world that have these two aspects of cannabinoid medicine combined. And we've made some really interesting discoveries, actually analyzing the medicine and figuring out what's working for people. Some of the most interesting discoveries are just how low doses can be so effective. In cannabis medicine, again and again, I've seen this theme of less is more, and today I'm going to help you understand how these incredibly low doses in certain situations can be the most effective. This isn't a rule that applies to everyone, but it's helped a lot of my patients. So before I tell you how to find your optimal dose, I'm going to introduce you to a few key concepts of cannabinoid medicine, and then we'll talk about dosing for treating chronic illness and chronic symptoms, both in people that are brand new to cannabis and in the experienced cannabis users. We'll talk a little bit about dosing for cancer and also dosing for disease prevention or promotion of wellness and health, staying healthy. So to discuss dosing, we need some terminology. Let's just go through this really quickly. When people are inhaling cannabis via smoke or a vaporizer, we generally refer to how many puffs or how many inhalations they're taking. The amount of cannabinoids that are delivered are we usually talk about milligrams of cannabinoids. You know, when we talk about dosing, we say, what are we talking about? It's the cannabinoids, THC, CBD, some of the trace cannabinoids that Dr. Land was talking about, and the acidic cannabinoids like THCA. So if you were to approximate how many cannabinoids you might get through one inhalation of smoke or vapor, we could average that to around 1 or 1.5 milligrams. Now, liquid cannabis medicines that we know the potency of are the easiest to accurately dose. We know their potency, we know how many drops or how many milliliters you're taking. We can very quickly determine how many milligrams you're getting and then see what your response is to that dose. Some patients are using cannabis concentrates like the one pictured in the syringe, a very thick, sticky substance that are usually 50 to 70% cannabinoids by weight. And when we discuss the dosing of these concentrates, people often describe them as little globs the size of a grain of rice. A grain of rice might contain 25 to 75 milligrams of active cannabinoids. So dosing by the milligram is a new theme in cannabinoid medicine, and it's really helped us take this field to the next level. The medical way of thinking about dosing by body weight, which I've described on this page for cannabis, is extremely wide. So I see people responding to very low doses. I see people responding to very high doses. There's actually a 300 to 600-fold dosing range that's safe and effective. We don't see that for any other medicine. Just to put this into terms that are easy to understand, for someone my body weight, I might do well if I had a chronic disease with 3 milligrams of cannabinoids a day, or I might do well with 1,700 milligrams per day. It's such an incredibly wide range, and when patients come in, we wonder, what's right for you? Well, again, we need a methodology to help you figure that out, and that's what I've developed. Now, researchers have wondered how much THC does it take to kill an animal, and they've really tried to do this and have failed. So monkeys that get 9,000 milligrams per kilogram, that's 600 times the maximum dose that I'm seeing in my practice, still survived. Although I'm sure it wasn't a pleasant experience for those monkeys. And I don't think it would be a pleasant experience for any of the listeners today to try these ultra-high doses without the guidance of a professional. Let's go to the next slide. So, oops, we skipped. So within this broad dosing range, we see something in cannabinoid medicine called the biphasic or multiphasic dose response. And this is one of the most important concepts to understand if you're going to find your optimal dose. When somebody starts at a very low dose of cannabis and gradually increases their dose, they'll notice more and more therapeutic effects as the dose goes up until they reach their optimal dose. Then as you increase the dose beyond your optimal dose, the therapeutic effects will actually start to diminish and side effects will start to emerge. I can't tell you where that optimal dose is for you. And truly, that optimal dose may change over time. As you become healthier and your system is closer to physiologic balance, the dose of cannabis that you need will probably go down. Your homeostasis, your internal balance system is functioning more optimally, and you need less help from the outside. Also, for treating different symptoms, you might need one dose that helps with pain or a different dose that helps with panic attack or anxiety. And it's important to know yourself to understand how to accurately dose yourself. Science has shown us that these biphasic or multiphasic dose response curves exist in animals and all across the board in cannabinoid medicine. This was an experiment that I thought illustrated this point very well, where mice were given doses of THC and their activity level was monitored. At a very low dose of THC, the activity level went down. This is analogous to anxiety or muscle spasms or other symptoms that we might try to treat in humans. Then as the dose increased, the activity level went up above baseline, and then as the dose increased again, the activity level went down again. But that second time it went down, it didn't go down as far as it did at the level of that ultra low dose, and at the higher dose, we saw the emergence of a side effect. In this study, catalepsy, which means remaining still in a strange position, which you can see the mouse doing here in the side of his cage. So this has also been shown in humans. CBD and THC spray given to patients with cancer that had chronic pain did the best at 20 milligrams compared to 50 or 83 milligrams. If you look at this chart, it's red, the decrease in pain is correlated with the size of the bar graph. So you can see the group that got the lowest dose actually did way better than the medium and high dose. And what's interesting about this study is the group that got the placebo did just about as well as the medium and high dose. This is a reminder that you all have an internal pharmacy that's producing cannabinoids all the time. And the power of your belief can trigger that pharmacy for your own benefit. This is a concept that I include in all of my programs and protocols because I don't think you have to be tricked into producing cannabinoids. You can do this intentionally with mind-body exercise and other physical activity and diet. In cannabinoid medicine, we often see what I call bidirectional effects. This means that the same medicine can cause two opposite effects. And this is very commonly seen in cannabis overdose, which usually causes things like pain, anxiety, nausea, and vomiting, all the symptoms that we would expect an appropriate dose of cannabis to decrease or relieve. Bidirectional effects are all over the place in cannabis, and even the same exact dose can cause an opposite response depending on the environment. So take a dose that you know works for you in a calm environment and it might relax you. Take that same dose in a stressful environment and it might cause anxiety. Having some clicker issues here. If we could go to the next slide, please. So let's, the therapeutic window. This is a great concept in medicine. The therapeutic window is the distance between the minimal effective dose and the maximum tolerable dose. And when people first start using cannabis, the therapeutic window can be somewhat narrow. When we're looking for the optimal therapeutic dose, it's going to be somewhere in that window. And what's beautiful about cannabinoid medicine is that if we approach it correctly, we can actually widen that window over time through the processes of sensitization and tolerance. Sensitization means that when people first start using cannabis, they generally become more sensitive to it over time. Their endocannabinoid system is becoming more sensitive. This takes the right or the left side of that window and starts to open it. And it's part of my protocols for introducing people that are new to cannabis very gradually so they can become sensitive. A lot of the listeners can probably relate to this because the first time or two that they tried using cannabis, they might have felt nothing. And then it was that second or third time that they finally got an effect. There was sensitization going on there. At the other end of the window, we have tolerance building, but almost always people that use cannabis at moderate to high doses for some prolonged period of time will build tolerance to the side effects faster than they build tolerance to the benefits. This again pushes open that window and allows it to get wider and wider because the maximum tolerable dose is no longer limited by side effects that used to be there. Now, a lot of patients have described their maximum tolerable dose limited by psychoactivity. And this is a new theme for me. I used to think that my patients would want to get high, but more and more I'm seeing over the last several years that people don't want to be impaired at all. They don't even want any psychoactive effect. They want to treat their pain or treat their nausea or whatever it may be, go to work and be unimpaired. There's certainly strategies that you can use, such as ultra low dosing of THC, combining CBD and THC, perhaps at a 3-to-1 ratio or greater, using the raw cannabinoids like THCA, and other strategies that I cover in my education material on healer.com. CBD is a great strategy both for new users and for existing users to help improve the benefits and decrease the side effects. CBD also has a bidirectional effect to it. So low doses are often stimulating and awakening, while high doses can be sedating. And some conditions respond to incredibly high doses of CBD, like THC. 100 to 500 milligrams per dose are sometimes needed to treat things like epilepsy and psychosis. Overall, as we add CBD into THC for existing users of cannabis, they tend to find different responses. And if you're an existing user, I encourage you to explore this to see how you can optimize your dose. You may find that your total number of milligrams goes up as you add in the CBD, but your requirements for THC may actually go down. In my practice, I've also seen some really incredible results with raw cannabinoids. And although here I have a bunch of raw buds pictured on a plate, the real message that I've been seeing using the analytics to guide our discovery is that tiny doses of raw cannabinoids can have profound effects that I would have never expected. And so if you haven't tried this before, I encourage you to experiment with just eating a very small piece of a raw bud once or twice a day and see what health benefits you can get from that. So for the new user, we have a lot of patients coming in that are brand new to cannabis. Pictured here is my grandmother, Elaine Sulak, on her 91st birthday. Elaine started using cannabis about 3 years ago, and since that time, she's had decreased pain from her arthritis. It stimulated her appetite, which is a major issue for her. She's become more clear cognitively and generally more positive and a better outlook on life and death, more comfortable with her own mortality. The transformation that we've seen is incredible, and she does not have to deal with any side effects from cannabis because it's dosed appropriately. For new users, I always recommend that they start out subtherapeutic and then increase that dose gradually until they just feel the minimal response, just the slightest effect. Stay at that slightest effect dose for 3 days, and then on day 4, go ahead and gradually increase again until you get the therapeutic benefits you're looking for. Again, this will help widen that therapeutic window. You don't want to rush into it, especially with new users when the window is narrow. An overdose of cannabis can be uncomfortable, and even though it's safe and non-toxic, it can really turn people off to the potential this medicine has for them, and they won't try it again. So for new users, it's a great idea to start low, go slow, and don't be afraid to go all the way. When I say low, I'm referring to 1 milligram, literally, especially if it's THC dominant cannabis, 1 or 2 milligrams. If you have the capacity to work with CBD, you can adjust that ratio based on the patient's goals or based on what the symptoms are that you're trying to treat. But if you don't know where to start, a 1-to-1 ratio of CBD to THC is broadly safe and effective for a wide range of patients. I always teach a self-awareness technique because if I'm empowering you to dose yourself with cannabis and find your optimal dose, then you have to be able to listen to your body and understand what it's telling you about your response to that dose. The self-awareness technique I teach is called the inner inventory. It's really simple, and I'm just going to walk you through it right now. So just take a minute, sit comfortably. Let's all do this together. And to begin with, I'd like you on a scale from 1 to 10, just take a deep breath and rate that breath for how easy and smooth it is. Just a single breath. And if you have pen and paper, just write that down on a scale from 1 to 10. The next measure is your body. How comfortable are you? So on a scale from 1 to 10, how easy is it for you to sit still or stand still? How easy is it for you to just ease into that stillness right now? Take a moment to observe that. And then the final measure is your mood. So on a scale from 1 to 10, how easy is it for you to authentically smile, to feel happy and appreciative? Write that down on a scale from 1 to 10. This whole inner inventory takes less than a minute, and I have all of my patients practice it before and after they dose cannabis so that they can pick up on the subtle effects that cannabis is doing to them, and they can know when cannabis is helping them and maybe when it's making them a little less comfortable, perhaps causing side effects if they've exceeded their optimal therapeutic dose. For the experienced users, I often help people reduce their dose. Believe it or not, in cannabis medicine, we see this again and again, less is more. So patients are coming in using a dose that's too high for them, and they tell me, cannabis isn't doing for me what it used to do. I used to get these great benefits, now I have to use more, it's not working as well, and I'm getting these side effects. Well, guess what? We actually have to reduce dose. And that's unusual. Until people really learn that this works for them and experience it themselves, it's hard for for them to believe that they could reduce the dosage and get a more powerful effect. But trust me, this works and it's true. And to help people do this, I've developed a 6-day protocol that helps them get through that process and lower their dose, find their optimal dose. Another couple strategies I'd like to mention for experienced users before I tell you more of the details of the sensitization protocol are switching from inhalation to an oral or an oral mucosal dosing method like a tincture or an oil. The oils or tinctures have a longer duration of action, a slower onset, but usually patients can prevent their symptoms instead of trying to chase them around and relieve them with inhalation. In general, I see people getting better results, having less side effects, and overall improving their quality of life using oral medicines, and then they can use the inhalation for breakthrough symptoms. Finally, try different strains, try different ratios of CBD and THC. If you're an existing user that's been really THC dominant, there's a whole new world for you with some of these CBD strains and preparations. So the sensitization protocol, 6 days, if we could have the next slide, please, starts with 2 days of cannabis abstinence. And that, during those 2 days, we make it very intentional, and I teach activities and diet that will upregulate your cannabinoid system. Again, so your inner pharmacy is making these cannabinoids for you, and you don't have to deal with any mild symptoms of cannabis withdrawal. On days 3 through 5, we slowly increase to the minimal noticeable dose, just like we did with the new user, and you stay there 3 times a day at that minimal noticeable dose. On day 6, go ahead and gradually increase the dosage until you find that you're experiencing the therapeutic effects that are equal to or greater than where you were at before you started the protocol. On average, my patients who go through the 6-day process will reduce their dose by 60%. This means they're saving money, they're getting more benefits, less side effects. If they're inhaling, it's less challenge to their lungs. Overall, it just helps people, and it makes more cannabis available for the rest of the community. Why waste it? You'll hear from some other experts in this summit about cancer dosing. And the main point I want to make is that while some patients are doing extremely well with ultra-high doses of cannabinoids to treat their cancer, I believe that other patients can do well with low doses. Some of the patients that are taking these ultra-high doses actually lose some of the symptomatic benefits that they were getting at low doses. And when we look at the science, we know that cannabis can kill cancer with a variety of different mechanisms. Based on that science, I believe some of these mechanisms are triggered by low doses, some are triggered by very high doses, and there's no way to know exactly what's right for you. So if you have cancer and you're working with cannabis, I encourage you to find a clinician that knows what they're doing and to work with them closely. Again, all the answers are inside of you. So if you can listen to your system, listen to your body, it will tell you how are you responding to this cannabis and what to do next. Cannabis has a great potential for disease prevention and health promotion. If we look at large population studies, we see that cannabis users have less obesity and diabetes. Cannabis can protect from heart attack, protect from the damage of stroke, prevent dementia, decrease blood pressure, all the anti-cancer properties, and relieve stress. Stress is a major component of almost every chronic illness. So I am certain that there is a role in this toxic, stressful environment that we live in for using cannabis to stay healthy and prevent disease. And if we're going to do that, I suspect the best way is with very low doses, even low doses of THC that are sub-psychoactive, that are so low you don't even feel them, but they're still active in the system, modulating the endocannabinoid system and promoting cellular balance, reducing inflammation, and subtly perhaps reducing anxiety. And then also the raw cannabinoids, which are non-psychoactive, have a variety of anti-inflammatory and antioxidant effects. In summary, cannabis dosing is highly individualized. No one can tell you how to do it, but we can teach you how to do it. Sorry, the summary slide. Thank you. Optimal dosage can be found if you keep these key concepts in mind. So the biphasic dose response, that's the most important one. If you think you've bypassed your optimal dose, try the sensitization protocol. You'll be amazed at how well it can help you improve your response to cannabis and reduce your dose. And then keep in mind the factors of sensitization and tolerance and these bidirectional effects. Optimal dose can change over time, so as you become healthy, repeat these protocols and give yourself a chance to use even less and less cannabis. And remember that ultra-low dosing and ultra-high dosing can be safe and effective in certain situations. I welcome you to explore my website, healer.com, to check out all my protocols, and thank you so much for your time today.